According to the CDC, autism or autism spectrum disorder is becoming increasingly common, and the numbers are on the rise. Of the 3.8 million children born in the U.S. in 2018, between 65,000 and 70,000 will meet that diagnostic criteria. Here to talk to us about the recent survey and life with a diagnosis, Dr. Steve Merahn and Kayla Schmidt. You guys, thank you so much for joining us this morning. Doctor, can you tell us first what exactly is ASD?
Autism spectrum disorder is what we would call a neurodevelopmental condition, meaning it's, I guess the best way to describe it is people who are differently wired. And what happens is individuals with autism have challenges with communication, social interaction, and behavior. Autism itself is not necessarily a disability, but the neurology of autism sometimes creates disabilities for people. What we've learned is that intensive intervention with therapies such as applied behavior analysis can really make a positive, productive change in these children's developmental path.
Right. So, Kayla, you have two children with autism. What are some of the challenges that you faced when it came to getting them diagnosed?
The biggest thing for me at first was accepting that they needed to be diagnosed. It's hard as a parent to swallow that pill and to think that something might be wrong or different with your child. So that was the hardest part. But since the diagnosis and we got connected with Centria, things have ran pretty smoothly for my family since then.
Doctor, can you tell us about the main highlights that nationwide survey found?
I think one of the most important things that we discovered from the survey is that there seems to be a disconnect between the time that parents first have some concerns about their child and the time children actually start therapy. That length of time in this survey is averaging about 15 months. And as a pediatrician, that really represents some lost treatment opportunity. Turns out that many parents don't know what to do once they have these concerns. There's not a clear path for them. Many parents struggle to find the resource that will help them make the decisions they need to make. And sometimes there are barriers along the way, whether it's people who are trying to be optimistic and think your child may grow out of it. The fact is, the sooner that you can kind of advocate for your child and get into a diagnostic situation to determine whether or not they have it, the sooner that the child can start therapy.
Now let's talk really quickly about applied behavior analysis, or ABA therapy. How does that help children with a diagnosis?
Well, ABA starts with where the child is. So you do an assessment, you look at some of their strengths and some of their challenges, you identify the very specific autism-related disabilities that may be barriers to their interaction with the world. You break the skills down into tiny, tiny pieces. You have the child master those smaller pieces, and then you take those smaller pieces and kind of roll them up to help them master more complex skills.
Got it. And Kayla, how has that helped your children?
It's helped my children every step of the way since they were 1 and they were diagnosed. Help them learn their name and learn how to respond to their name. And now that they're older, it's helping them learn how to play and communicate and interact appropriately in social situations with other children their age.
Amazing. So where can we get some more information for any parents out there?
I think that it'd be a great idea to go to CentriaAutism.com, and if you think that you might need a diagnostic process for your child, call 1-855-77-AUTISM.
Great. Thank you guys again for joining us, and you at home, you can check out this segment a little bit later on our website. First